With kids back in school and more of us going back to work in person, doctors are worried about more than just COVID. There's also the upcoming flu season, and we're joined by Dr. Scott Itano from Kaiser Permanente. Dr. Itano, good to have you this morning.
Thank you so much for having me.
So I know the flu is going around. I've been speaking with friends of mine, and they say, man, workers are out, kids are out right now, and it's a huge concern with COVID going around, and now we're talking about flu season. So obviously this is a concern for parents, employers, employees, everybody.
Absolutely. It's a huge concern because flu generally does cause hundreds and thousands of hospitalizations and deaths every year. And so when we already have a stressed healthcare system from the COVID pandemic, it's even more important to be precautious about the flu.
And if you can just take us behind the curtain for a moment. I mean, I know that we are dealing with massive shortages at hospitals right now. How could the combination of COVID and the flu impact hospitals?
Right. When you're talking about a twindemic, when you have both a flu and a COVID pandemic, adding stress to an already stressed healthcare system could be catastrophic for the healthcare system.
Okay, so we know that COVID and the flu have similar symptoms. So when should we go get tested?
Absolutely. The COVID symptoms and flu symptoms pretty much overlap one another. You're looking out for fevers, chills, sweats, difficulties breathing, muscle aches, severe fatigue, sore throat, or diarrhea, or that loss of taste or smell. So because you can't distinguish one from another based on symptoms, when you do get symptoms, you really should get tested for COVID because that's what's going to help clarify what's going on.
There are a lot of people that are anti-vax these days, people that don't want to get any kind of a shot now. What would you say to folks that are hesitant not only about getting a COVID vaccination, but also getting the flu shot?
That's such a great question, and I'm glad you brought that up. Really, the best protection and prevention we have is vaccination. It's the same thing for flu vaccination. Getting the flu shot doesn't necessarily mean you're 100% protected from getting the flu, but it means that you're 3 times less likely to die or get hospitalized. So it's the same thing for the COVID vaccination. It's so important to prevent COVID infection, but then if you still get COVID and you've had the vaccination, you're much less likely to have severe disease or hospitalization or death.
We have, sporting venues opening back up. We have, concert venues opening back up. There are some pretty good-sized crowds, and people are not masked up all the time. People are not doing the social distancing thing. From your perspective, is this a good idea?
It really just makes us hone in and lean into those prevention measures that we've been talking about. Last year, we essentially didn't see flu because we started social distancing and masking and washing our hands and quarantining when we have symptoms. And that's how we prevent this from getting worse. So it's really just re-embracing what we already know and how to prevent COVID and flu at the same time, and making sure we're all doing that at the same time.
Really great perspective, and we appreciate your time. Dr. Scott Itano from Kaiser Permanente.